Hello everyone, my name is Dr. Anushiravanariakish and I am a London dentist with over 22 years of experience. As a restorative dentist, I have treated over 120,000 patients since 1998 with a variety of procedures ranging from simple fillings to complicated root canals, surgical procedures, gum treatment, orthodontics and aesthetic procedures such as veneers and tooth whitening. Having performed countless numbers of tooth whitening procedures of different types over the past 2 decades has given me a good insight and experience regarding what works, what doesn't, and what type of tooth whitening would meet a patient's expectations. In this video, I will talk about the reasons behind darkening of the color of our teeth and the most common treatments that can give us good results in addition to their potential side effects. In general, tooth stains are classified according to their location into intrinsic or extrinsic discolorations, and by that we mean internal or external change of color. Intrinsic tooth color is associated with the light scattering and absorption properties of the two structural layers of our teeth, named enamel and dentine. Intrinsic or internal discoloration occurs when a change in the structural composition or thickness of these tissues takes place during tooth development or after eruption. There are a number of disorders that may cause intrinsic discoloration. Some of these are metabolic disorders, medical treatments, inherited diseases, idiopathic or, in plain language, unknown diseases and traumatic causes. On the other hand, extrinsic color is associated with the adsorption of different compounds onto the surfaces of enamel, which could develop surface stains. These discoloration are caused by chromogenic substances that attach to the tooth directly, for example, tannins found in tea, coffee and other beverages that could promote brown stains on the surfaces of the teeth. Tobacco smoking, which is known to cause dark brown and black staining, and the oral hygiene, which is also involved in the direct extrinsic discoloration. Accumulations of dental plaque, calculus and food particles also cause brown or black stains. Extrinsic discoloration could also happen indirectly via chemical interaction of external compounds and the tooth surface. An example of this is chlorhexidine mouthwashes, which are most effective in controlling plaque and gingivitis but cause a significant deposition of extrinsic stains. In brief, the factors causing tooth discoloration are diverse. Because of this, it is very important to know the causes of tooth staining for better prevention of tooth discoloration and selecting the whitening treatment that is most appropriate for achieving the desired color of the tooth. There has been an increasing demand for whiter teeth. Home-based whitening products with a whitening action have become popular and are prescribed to people by the dentist or purchased over the counter. A variety of whitening products are available, which includes hydrogen peroxide, carbamide peroxide, sodium percarbonate, sodium hexametaphosphate, sodium tripolyphosphate and calcium peroxide. These agents are supplied in different concentrations and are used with different methods of application, such as gel in tray, whitening strips, paint on gel, chewing gum, toothpastes, mouthwashes, with varying application times and duration of treatment. It is of note that some of these products are now banned in Europe. Several whitening systems have now been defined over time. The classification has been done according to different parameters like the whitening agents used, its concentration, its application form, or its application intervals. Whitening systems are generally divided in two groups: in-office and at-home whitening systems. Carbamide peroxide whitening products are available at different percentages, most commonly 5, 10, 15 or 16%. Carbamide peroxide stays active through the night, with the first 3 to 4 hours being the most potent time for the average 10 to 15% gel. 3% to 6% hydrogen peroxide products have also been incorporated into some whitening strips or gels. These are effective in general as a periodic top-up for already whitened teeth and not as the whitening treatment itself. In-office whitening systems are those applied by dental healthcare professionals at their clinics. These treatments are generally carried out by the use of high concentrations of oxidant agents such as hydrogen peroxide 6% during short periods of time. The oxygen within these gels dissipate between 30 to 60 minutes, which means they are only active for a short period. Due to the use of high concentrations, the rest of the mouth must be protected from the oxidant agents. The isolation of the soft tissues is carried out with soft barrier products placed by the dental healthcare professional. In addition, eye protection against the high concentrations of oxidant agents must be worn by both patient and dentist. In some cases, the treatment requires an activation stage using heat or light, which could involve additional safety measures. The advantages of the Inoffice treatments include minimal dependence on patient's compliance and immediate visible results. The results can appear after 15 or 30 minutes of application, but they will require several applications for achieving an optimum whitening effect. However, patients will also need to use a home whitening system as an adjunct for desirable long-lasting results. In-office whitening systems also have disadvantages, like the high cost, the chair time, the need to combine these procedures with at-home whitening systems, and the occurrence of undesirable effects like tooth hypersensitivity. The other very common group of whitening systems is the ones done at home. These kinds of products are easy to use and relatively more economic than in-office systems. At-home whitening systems can be subdivided into two types: provided and supervised by dental healthcare professional such as a dentist or dental therapist, and over-the-counter tooth whitening products such as, for example, toothpaste and whitening strips. Professionally supervised products consist of professional tooth whitening trays used at home with dentist supervision. These systems are made of soft plastics with the shape of the patient's teeth, containing the whitening gel to be in contact with the teeth. Generally, the product instructions recommend 2 applications per day, with a duration from 30 minutes to 2 hours, or an overnight application for 2 to 6 weeks. The concentrations of the oxidant agents are lower than the in-office treatments, for example, 5% to 16% for carbon white peroxide. At-home tray whitening requires a higher number of steps to achieve the desired results, which includes silicone imprints of the teeth and 2 to 3 appointments. The patient is instructed on how to place the whitening gel in the trays and how to remove any excess gel after insertion. Besides, the patient's commitment and compliance with instructions is necessary for optimal results. Over-the-counter systems can be acquired without the supervision of the dentist. These products include whitening toothpastes, whitening strips and gels, whitening rinses, and tray-based tooth whiteners. These over-the-counter systems are easy to use, however, they have a low whitening potential in comparison with professionally prescribed and supervised products and in-office treatments. This is due to the use of lower whitening agent concentrations, reduced exposure, and contact times. Therefore, over-the-counter products must be used for a long time to obtain acceptable results. Another disadvantage with over-the-counter products systems is that the people use them without diagnosis of teeth discoloration. Consequently, the use could be inappropriate. The peroxides from an over-the-counter product may have negative effects on the bonding of composite resin restorations. Therefore, the dentists have to know whether the patient has used the whitening treatment and how recent this treatment is. And this monitoring could be difficult in the case of over-the-counter products, leading to potential debonding of the dental restorations. One of the biggest and most common side effects of whitening treatments is tooth hypersensitivity that could lead to treatment interruption. Systemic effects of whitening agents such as allergic sensitivity, toxic effects, genotoxicity, carcinogenicity, which in plain language means potential for causing cancer, have not yet been reported on human cases under professional exposure. A powerful Cochrane systematic review research in 2018 could not draw any conclusions regarding the superiority of home-based whitening compositions or any particular method of application, concentration, or application time or duration of use, as the overall evidence generated was of very low certainty. The review revealed that the most common adverse events were tooth sensitivity and oral irritation, which were reported with higher concentrations of active agents, although the effects were mild and transient. Up to 85% of patients experience sensitivity during the tooth whitening. The sensitivity is mostly felt on the 3rd day of the tooth whitening. To eliminate the sensitivity, the techniques that can be used are application of fluoride gels, potassium nitrate gels, and desensitizing toothpastes into the trays, followed by wearing them for short periods during the day, in addition to professional application of sealing varnishes or bonding agents onto surfaces of the teeth. Patients can also use the whitening trays every second or third night to reduce treatment exposure time and frequency, or use lower concentrations of whitening gel. A very common question is if teeth whitening can treat the white spots on the teeth. Here, let me talk about etiological classification of white spots. White spots on our teeth can be due to hereditary factors, trauma, fluorosis, which means tooth tissue damage from excess fluoride intake during the tooth development, tooth decay, hypomineralization, poor oral hygiene, congenital premature birth, child illness, demineralization around orthodontic brackets during orthodontic treatment, and intake of drugs such as antibiotics, for example, in childhood during early tooth development. In general, tooth whitening cannot treat these conditions. However, there are several treatment options available that can be carried out to eliminate the white spot appearance once the tooth whitening is performed. Finally, I would like to mention that tooth whitening is a safe aesthetic dental treatment when carried out by a qualified dental professional, such as a registered dentist or dental therapist, after a comprehensive dental assessment. In my next upcoming video, I will be talking about how the tooth whitening works and treatment options for eliminating white spots. Thank you for watching. Stay tuned.